Hello everyone, myself Dr. Prateek Garg. So today we will discuss about cavernous sinus thrombosis. I know it is very confusing to understand the pathology of the cavernous sinus thrombosis and how will the clinical features will appear. So let's have a brief idea about cavernous sinus anatomy and its pathology. Look out at the diagram, we can see the two of the cavernous sinus each side. And these cavernous sinuses, as you can see, are marked by this blue. We represent the veins by the blue color. So in this picture, you can see this bluish complete landmark is the cavernous sinus of each side. So this is our cavernous sinus of one side and the cavernous sinus of opposite side. You can see both side cavernous sinus are intercommunicated. We will mark this with the help of the black color. So you can see here these cavernous sinus are intercommunicated with each other. So let's understand the anatomy or the boundaries of cavernous sinus. So this sinus lies in the skull bone, just above the sphenoid bone. So inferiorly, this cavernous sinus, we can see it is bounded by the greater wing of sphenoid. You can see the greater wing of sphenoid forms the inferior boundary of cavernous sinus. Medially, there lies sphenoid sinus. That is the sinus present in the sphenoid bone known as sphenoid sinus. And what else? There is sella turcica. So this is sella turcica where our pituitary gland rests. So cavernous sinus inferiorly there is greater wing of sphenoid bone. Medially there lies sella turcica with the pituitary gland resting in it and sphenoid air cells. Superiorly, the cavernous sinus boundaries are firstly the internal carotid artery. So this is our internal carotid artery. You can see here. This is my internal carotid artery superiorly along with optic chiasma. This is our optic chiasma and optic nerve. So this is optic chiasma. So superiorly there lies internal carotid artery, optic chiasma with optic nerve. So it is being written here, optic tract with the optic chiasma and internal carotid artery. And laterally there is temporal lobe. So this is our temporal lobe which forms a lateral boundary of this cavernous sinus. Anteriorly there lies superior orbital fissure. This is a fissure present in the sphenoid bone. So we can see this cavernous sinus is mostly covered by this sphenoid bone, medially, inferiorly, anteriorly. Laterally there lies temporal lobe, superiorly there is carotid artery plus optic chiasma and optic tract, and posteriorly there is petrous temporal bone. The apex of the petrous temporal bone forms the posterior boundary. So I hope you got a clear little bit of imagination how this cavernous sinus is located, what forms its boundary. Now look out at other diagram. So this is a diagram showing the venous drainage into the cavernous sinus. Why this cavernous sinus is important? See, most of our facial venous like the angular vein, supratrochlear, supraorbital vein, inferior palpebral vein, infraorbital vein, facial vein. These are all draining into the cavernous sinus by means of either ophthalmic vein or by means of pterygoid plexus. So look out this diagram. So firstly, this is my superior ophthalmic vein, so being marked by this arrow. So this main cord bluish structure, this is the superior ophthalmic vein, and then lies the inferior ophthalmic vein. So this is our inferior ophthalmic vein. So superior and inferior ophthalmic vein, these are being drained by supraorbital vein, supratrochlear vein, superior palpebral vein, and angular veins, and retinal veins also. You can see the retinal vein and lacrymal veins. Okay, so these the venous supply around the orbit, these are draining into superior and inferior ophthalmic vein, which directly goes into the cavernous sinus. And what next? The facial vein. So this is our facial vein. You can see this facial vein is carrying the blood from the face and draining into the pterygoid plexus here, and this pterygoid plexus further communicating with this cavernous sinus. So the most of the supply from the face is going or draining into the cavernous sinus. Now we all know the dangerous area of the face. So you see by means of this diagram, any infection, any thrombus, any embolus or any sort of trauma at this dangerous area of the face can directly lead the infection or the thrombus into the cavernous sinus. That's why this area is known as cavernous sinus. And you know, this venous supply, there are valveless vein. I mean, there is no valves in the vein. So infection or the thrombus can directly lead into the cavernous sinus. That's why this cavernous sinus anatomy, cavernous sinus thrombosis become very important for us to understand. I hope this much is clear. Now, how this cavernous sinus will look on MRI. So look out this axial section. So this is our axial section. Axial section, you means like taking the view from this, like this. Okay. So we are cutting the brain like this, and look out this diagram. I am marking it with the red color. Okay. So these are both cavernous sinus. And if we look out at the coronal section means like this, to take the cut like this. So again, this cavernous sinus is being located here. So MRI serves the best investigation to look out any pathology of cavernous sinus, to check out for the thrombosis, to check out for the sepsis of the cavernous sinus, MRI being the best investigation. Now, what is cavernous sinus thrombosis? We have already discussed how the infection may progress into the cavernous sinus by means of valveless veins, by means of superior or inferior ophthalmic vein, or by means of facial vein pterygoid plexus. So what will be the clinical features? So again, this is the same diagram showing the cavernous sinus. First, we will talk about the content of cavernous sinus. Now, in the middle of the cavernous sinus, that is a matrix of the cavernous sinus, there is 6 cranial nerve. You can see this yellow structure. This is my 6 cranial nerve. Look out at this arrow. So this is abducens nerve. That is a 6 cranial nerve, only cranial nerve, which passes into the matrix of the cavernous sinus along with the internal carotid artery. So this is my internal carotid artery. So internal carotid artery and abducens nerve, they both passes into the matrix of the cavernous sinus. And in the lateral wall of cavernous sinus, then there lies 3rd, 4th and 5th cranial nerve. So in trigeminal nerve, that is a 5th cranial nerve, only V1 and V2 branches are present, that is ophthalmic division and maxillary division. So this is ophthalmic and this is maxillary. So in the lateral wall, there lie 4 structure. 3rd cranial nerve, that is the oculomotor cranial nerve. 4th cranial nerve, that is trochlear, and 5th, the part of 5th is V1 and V2. So this is the content of the cavernous sinus. So any pathology or thrombus of this cavernous sinus, firstly, what that will do? Firstly, the venous supply from the face, from the eye will be occluded, leading to engorgement of the retinal vein, engorgement of the ophthalmic vein, leading to orbital chemosis, redness, loss of vision gradually, and there will be the cranial nerve palsies also, like the 3rd, 4th or 6th cranial nerve palsy. Since 6th cranial nerve lie in the middle of the cavernous sinus, so this is the first cranial nerve to be affected in the cavernous sinus, leading to lateral rectus palsy. You can see in this diagram, this is lateral gauge palsy being this is being affected by means of the 6th cranial nerve palsy, that is abducens nerve. You can see if we try to ask the patient, if we ask him to look at laterally, so one normal eye will move laterally, but the other affected eye with the cavernous sinus thrombosis can't be moved laterally. So there is lateral gaze palsy because of 6th cranial nerve affection. And what else? What will be the clinical feature? There will be high fever. Then comes periorbital edema, chemosis, because the venous drainage can't be done properly because of the thrombus. So the all blood will get collected into the eye, leading to chemosis or periorbital edema. Then there will be other cranial nerve palsy in later stages like the third, fourth and fifth cranial nerve palsy, and there will be decreased visual acuity. So try to understand how we know the anatomy, then we can easily differentiate what will be the clinical features. Now, cavernous sinus thrombosis, usually it is septic but can also be aseptic. So first we will talk about the septic causes. The septic causes may be any infection from the dangerous area of the face, like from the corner of the mouth to the bridge of the nose. There can be abscess, vestibulitis, cellulitis, sinusitis, especially sphenoid sinus infection or ethmoid sinus infection. Then there will be dental infection leading to maxillary infection and directly draining into the cavernous sinus. Then there will be some surgical procedure, post-surgical procedure like the extraction of the tooth, or any nerve block, even a posterior superior alveolar nerve block. That this block may hamper the pterygoid plexus leading to cavernous sinus thrombosis. And other causes may be otitis media or mastocytitis. How? Because in otitis media mastocytitis sometimes there happens a petrositis, and petrous part of the temporal bone forms the posterior boundary of the cavernous sinus, and that's how it may affect the cavernous sinus. Aseptic causes may be any trauma, surgery or pregnancy. Pregnancy is a stage where there is a hypercoagulation, may lead to the aseptic cavernous sinus thrombosis. Now this cavernous sinus thrombosis leads to decreased drainage from the facial vein and superior and inferior ophthalmic vein, resulting in facial and periorbital edema, ptosis, proptosis, that is a protruding of the eyeball anteriorly. Then comes a chemosis and pain around the eye. If we try to move the eye, then there will be the pain in the eye muscle movement. There may be the papilloedema and retinal venous distension and the vision hampering. So we know how this symptom are going to produce, just because there will be the venous drainage of the eye and the face will be hampered. Now, sixth cranial nerve is the first or the most common neuropathy, because the sixth cranial nerve lies in the substance of the cavernous sinus. So there will be the lateral gaze palsy, there will be the partial ophthalmoplegia with limited eye abduction, I mean to see the laterally. Then occurs the internal ophthalmoplegia. It will result in the non-reactive pupil. Why? Because there will be the paralysis of the iris and the ciliary body, which are responsible for the pupil size adjustment. So because of this venous engorgement, there will be the iris and ciliary body paralysis leading to non-reactive pupil. So sometimes there may be the miosis, we can say the constricted pupil, that will be because of the loss of sympathetic supply, the loss of sympathetic fibers, and these fibers are present from the short ciliary nerves. So there can be miosis because of the obstruction of sympathetic fiber supply, and there can be the mydriasis, that is a dilation of pupil because of the loss of the parasympathetic fibers from third cranial nerve. We know in the eyes the sympathetic fibers are present around the arterial venous supply or arterial supply and from the short ciliary nerve, and the parasympathetic supply fibers, these are around the third cranial nerve, that is the oculomotor nerve. So both may get hampered, leading to miosis and mydriasis respectively. Now CT scan and MRI are helpful. If we ask for the better investigation, the MRI is the best investigation to know the modalities, best diagnostic modality to know the disease and the pathology of the cavernous sinus. So how we will treat? So treatment will be higher antibiotic, low molecular weight heparin to relieve the embolus or the thrombus clot. Then we can give the steroid to reduce the inflammation, and then correcting the underlying cause like the sinusitis or mastocytitis, doing the relevant surgery. If there is mastocytitis, then we can go for the mastectomy. If there is sinusitis leading to cavernous sinus thrombosis, so we can do the endoscopic sinus surgery. So that's how we can treat this cavernous sinus thrombosis. So that's all. I hope you better understand the cavernous sinus by this presentation. Thank you.